Well, thank you everyone for joining our second Wellbeing Circle here at Edible Health. We're incredibly excited, Olivia and I, to host this event. And we have the wonderful Maddy joining us, who's a registered midwife and specialises in home births.
Awesome. Hello, everybody. I am so excited to be here. Um, Edible Health is owned by one of my best friends, and so I'm super excited to combine my experience with pregnancy, birth, postpartum, and learn a little bit about collagen and how important that also is, but how to prepare for pregnancy, birth, everything and beyond pregnancy. So excited to be here. Thank you for having me.
And
Perfect.
if
Well,
anyone sorry, go for it.
sorry, you go, Olivia.
I was just about to say, if anyone has any questions, just pop them in the chat and we'll do our best to answer them in this short 30-minute call. But if we don't have time, we'll follow up with an email.
Awesome.
Because the last time we spoke, we actually ended up chatting for over 2 hours on all things pregnancy, so we can tend to get carried away.
Yeah.
But I guess so. This circle that we're holding today, we'd like to take you through pre-pregnancy, the 3 trimesters, and post-pregnancy. So over to you, Olivia, for the first question.
Sure. So let's dive into pre-pregnancy. So, Maddy, what are your top 3 tips on how to prepare, just in terms of mindset, when to get off contraceptive, etc.?
Yeah, exactly. So, sometimes I think when it comes to conception, we're very much like, oh, we should be conceiving in the first month or the second month or the third month. And we, I find, get very caught up in our heads about conceiving. And what I have experienced with people who are having fertility problems is by the time they just say, okay, never mind, I'm going to stop worrying about it, is when they actually conceive. And the way I perceive this is a bit of like a surrender experiment, which I believe like we need to surrender to the fact that our baby will choose us when we're ready. Like they pick, we don't, we try, but they will choose us to be their parents and they will choose us to be their vessel and whatever, right? So I think by the time, like, it's a very big surrender experiment. So you're also surrendering as soon as you do conceive to the outcome of your pregnancy and your birth, and you're surrendering to what parenthood might look like. And so, or I actually just perceive it as a big surrender experiment. Like we need to stop worrying about this timeline of conceiving and just trust that our bodies are actually going to do it when it is perfect timing. So in terms of birth control, I really feel like, we went through a period of time where it was historically like female empowerment to become aware and conscious of how we could prevent ourselves from getting pregnant. And it was, like we can go on this birth control and now we can control whether we get pregnant or not. And it was seen as like this type of empowerment for women. But ultimately, what I believe is that it's actually more disempowering. And the more we can get in touch with our own bodies and understand our natural cycle and our rhythm. And I actually feel like that brings closer intimacy with your partner too, because you're discussing, when am I fertile? When am I not? Do we want to consciously conceive our baby or do we want to prevent a pregnancy? Like you're more intimate in so many different ways. And I think that inevitably we're kind of interrupting our normal natural hormonal process by being on contraceptives that ultimately are reducing our natural levels in our body. And so I feel like if we could push people towards more of a natural way of being conscious of your hormones and your cycle, you'll have an easier time conceiving as well. But you're also going to be so much more intimate with your partner when you are consciously deciding when to have your baby. So, I mean, I've been on birth control, I've been not on birth control. I haven't been on birth control for almost 4 years because I've been consciously aware of my own body and my own rhythm, which took a lot of time to learn, natural family planning. But I feel like, we are disrupting, like we have weight gain, we have acne, we have all these disruptions which we could avoid if we were just more in tune with our bodies, which is going to serve you in so many different areas of your life, period, right? And so I think you'd said, what are my top tips as well? Yeah. Okay. So obviously, like moving your body, staying active, like eating healthy, which I believe includes a very well balanced diet, including protein and meat. I think that's very important in our diet. I understand that people are vegan. And when it comes to building a baby, like at least considering some form of protein in pregnancy, because it's so important. The building blocks to your baby, essentially, really. And that's where I think collagen is such a good option, because if people don't want to eat meat, it's essentially its own food group anyway. It's bioavailable natural form of protein that our bodies are going to utilize as an alternative to meat or as a supplement to the meat we're also eating. I think 90% of birth is psychological. So reading books, preparing your mind, preparing your body. What I've experienced in the last little while is very interesting, and it's just my own observations. But when people don't disclose assault or abuse or something like this that they've experienced in their life, it surfaces at the time of birth. And I think because it's triggering a memory in our body, and although very different experiences, it can mimic a similar sensation, right? And so working through trauma and preparing your mind, body, soul for this experience, this transformation into, you know, into being a mother, right? So working through your traumas and reading lots of books, listening to podcasts, things that reaffirm natural, normal physiological birth. So the one book that I highly recommend to all of my clients is Ina May Gaskin's Guide to Childbirth. And it's a longer book, but it just tells all positive stories of birth experiences between partners, and it's a really just a beautiful book. So those would be some of my quick tips.
Amazing, thank you. I think there are so many different options now for contraception and how to come off it and to manage your own body. I know that over in the UK, quite widely used, a lot of my friends use it, as the Flow app. And that really makes you in tune with your body to see, okay, well, I'm registering my temperature, or actually my boobs feel sore at this time of the month. And so you start to get into the habit of really being familiar with your body. And it's interesting how much over the last 5 years, I'd say, watching my friends transition onto this app as a form of contraception, and that will help you along the journey on trying to get pregnant. So there are lots of options out there, and I think that it's not as frowned upon as much as it once was.
No, and honestly, like, you can start to recognize your own emotions, like you can, you know, your discharge, your cervical mucus, even the position of your cervix, if you feel like feeling it. Like, it's, the world is your oyster when you start to really understand your own body, right? And then, like, I can't even trick my husband into getting pregnant now, because like he knows me too well. I've been trying, so.
Oh, that's brilliant. So we've now got the first trimester. So you've fallen pregnant, great, amazing, but actually it is quite daunting. You don't know what to expect. It's nerve-wracking, it's exciting in the same breath, because you want to announce it to the whole world. So what do you say to someone who's just found out what to expect? Top tips for people who are struggling with sickness or I guess anxiety of the unknown. There are so many things. You can fall into a rabbit hole on social media and start to see people who have gone through different experiences that you think is what your experience is going to be like. So what would you say your tips are for the first trimester?
Yeah, so I mean, as soon as we find out, I think everyone has, I mean, I guess if you've been having fertility problems, you're probably so excited, but I think realistic expectations, but also that surrender, again, like, is a very prominent word, I think, through all of conception, pregnancy, delivery, we're always surrendering. We don't know the outcome of your birth. We don't know the outcome of your pregnancy. Like, you're still very early, right? Your, risks are always there, like miscarriage, everything, right? So it's you need to trust your body, and you need to trust that this baby has chosen you for this period of time, and if it's meant to be, it will be. Often people have some side effects of being pregnant, obviously, like nausea and vomiting, sleeping problems, restless legs, constipation, like round ligament pain as your uterus is growing, right? So some of the things that I would recommend is, I have a really good cheat sheet, which I'm not sure if you guys are going to post this, but I'm happy to share it with all my, like, oh, you have a headache, here's a remedy. Oh, you have this, here's a remedy. So I'm happy to share that. I won't go fully into all that.
That'd be amazing.
Yeah, I did write down, like, sort of in my experience, the top, I don't know, 5, common complaints of early pregnancy. And so first is nausea and vomiting. And so what I find is that if you're having small, frequent meals throughout the day, you're going to keep your blood sugar stable. And when your blood sugar is not stable, then you will start to feel a little bit lightheaded, or you'll start to feel nauseous, and then you don't want to eat. And then it's kind of this downward spiral of, like, I feel ill, so I don't want to eat. And then you don't eat, and then you feel sicker, So one of the biggest things I suggest to people is a handful of almonds or cashews or something beside your bed before you even get out of bed. You're chewing on something high in protein, and then drinking a glass of water, and then getting out of bed. And so it's a process, but you don't want to get out and have low blood sugar, because it's just going to wreck the rest of your day. And nausea and vomiting usually resolves around 12 weeks, sometimes as late as 16 weeks, but then you're sort of hitting the second trimester, where it's like heaven for most people. And so just keeping in mind, like, it's, again, you're going to experience this again when you hit the end of pregnancy, and you're like, oh, when is this ever going to end? When is this ever going to end? But there are usually, like, goals, okay, I'm 10 weeks, a couple more weeks of this, I can do this, like, rest, look after yourself, stay well hydrated. Later in pregnancy, common discomfort is sleeping. Everyone gets uncomfortable. My biggest go-tos are called skull cap. I get it in a tincture form. It's a natural plant medicine. It's a mild sedative, and so I put a dropper in a cup of water and drink it before bed. It's safe in pregnancy, and it's not gonna, like, completely knock you out or anything, but it's gonna quiet all those little creaks in the house, or those little noises. Really good for postpartum, when your baby makes all those really interesting noises. So that's one. And then there's another thing that we have here in Canada. I'm sure it's everywhere, but it's called Rescue Remedy, and they have a daytime and a nighttime formula. And those are really good. I take those when I get a pager call in the middle of the night and need to go back to sleep, and my head's like, oh, someone's in labor. It just helps me, like, quiet down my mind. And then sleep hygiene, like, often we're all on our phones or our tablets or whatever until we close our eyes. And if you can get into a routine at the beginning of pregnancy, you'll create a habit. And by the time you reach the end, when you're really uncomfortable, you've got a plan in place, right? So maybe that looks like putting your devices away, running a nice bath with some candles and some lavender and Epsom salts, and then going straight to bed and just closing your eyes, or listening to an audiobook or something, where you're not scrolling through Instagram or something, because then your brain is just firing. So those are sort of my tips. Lots of pillows, making sure you're comfy in bed. And then constipation, that was another one, especially if people are taking iron supplements or any, like, protein iron supplements, then the side effect of that is constipation. And so, this is an area where collagen actually supports our gut health a lot. It can help us to not be constipated, but it can also help our joints. And so I would, you're wanting to have more protein in your diet, you're wanting to stay very hydrated, more fiber. And then you can take also a magnesium citrate, which is kind of a form of magnesium that's more like a laxative that's going to help move your food through, so you're not straining, because if you're straining, then you're going to maybe get hemorrhoids, and we just want to be as proactive as possible. So collagen for so many different reasons. So those are some of the big ones that I see a lot of.
So Maddy, you were just talking about round ligament pain.
Yes. So your uterus is suspended by all these ligaments, right? And as your uterus stretches, those ligaments also stretch, right? And so obviously, collagen supports the stretching of our skin, hopefully reducing things like stretch marks, but also can support all those ligaments that are stretching, but also support your perineum and your vaginal canal when you're delivering. Because if we have elasticity and we're supporting that even more with collagen, then we might reduce stretch marks, we might support our ligaments, and we might reduce our, possible tearing. And, collagen is the main component of connective tissue, that it's like glue and it holds us all together, right? And so an extra boost for our joints, an extra boost for our ligaments, an extra boost for our skin. Why wouldn't we try to nourish our body as best as possible throughout our pregnancy and delivery as well? So I just wanted to add that, because our bodies are changing, our breasts are changing, everything is changing about our bodies, and that's a whole, adventure in itself. But if we can support it and reduce the risk of all those different discomforts, then that's a really good way to do that.
So sorry, Jess, I'm just going straight for it.
Go straight for it.
So second trimester, then this is usually when people start to feel a bit more about themselves. So what would you say is the best way to make the most out of this time?
Yeah, second trimester is like the time where you're just starting to show. People are like holding doors for you, and they realize you're not just like maybe chubby, but you're actually building a baby. And so all of those discomforts usually go away. Your hormones sort of regulate, you feel good, you get a boost of energy. My advice is just soak it all up, enjoy it, maybe go on a little trip with your partner or whatever. Just really enjoy it, because it is a time to just feel good, like appreciate your body, and just move through that, knowing that you're getting closer to the end, but you're also, feeling like you're normal and you've got all your energy. So just enjoy it. That's all I can say, is enjoy it.
I think that's probably the most exciting trimester. You can start exercising again. You get to start telling people if you haven't told them already. And you get your glowing skin, glowing hair, which is always quite exciting. Feel like the queen.
Would this be a good trimester to discuss with your midwife whether what kind of birthing options you've got, or would you do that sooner or later, just in terms of home birthing, etc.?
I think it's always an open dialogue, at least with my clients. When I do my initial visit with them, I express to them that as midwives, we're the only care providers, unless you have a traditional birth attendant or someone else who works out of the system. Then you're wanting to, like, I always explain, I love home birth. That is where my niche is. That's what I love supporting. I love tucking moms into bed with their babies, and I love that it's quiet and peaceful. There's always going to be certain disturbances in hospital setting, like someone coming in, someone needing something, going to find a blanket, like instruments, whatever. The hospitals are just a different ballgame. But at home, it's just peaceful. You've got your own music playing, your own lights on, your own access to food and water, and whatever you want to do, wherever you want to go, it's comfortable. And so I tell my clients, I love home birth, and I want to talk to you about it and prepare you for it. And if they're like, no, I want hospital and an epidural, I'm not like automatically no, but I'm like, let's just talk through these things, the risks associated, your concerns, your fears, and why. Because home birth is a safe option for low risk people who are healthy and well, right? There's no reason why we can't offer a safe home birth to all women who have no complications, right? We're watching for those things. We'll talk about them if they arise, but so for me, having the discussion about where you want to birth and how to prepare is really from the get-go, because it is something that you need to psychologically work through. You know, I always say 90% of birth is psychological, 10% is what happens to you. And so it's a mind game from the very beginning. And your mind will tell you, you can't do this. This is hard. But then you're saying, no, actually, I'm a strong woman and I can do this. And many women have done this before me. And I feel safe and I feel good, right? Like if you feel prepared emotionally and psychologically, you're going to do just fine, right? We're always watching for the things that maybe are making this not normal anymore. I'd say our statistic of actually transferring into the hospital from a planned home birth because of a complication is very, very slim. I've done it once and I've attended almost 50 births. So maybe 1 in 50 for me right now. I'm not sure how that equates to every other midwife, but it's pretty low, I would say. And yeah, so I don't know what the question was anymore.
That's such an incredible statistic. I think they are on the rise, home births, and I want to say actually in Denmark it's the norm to have home births, because of the environment, especially people being more in touch with their bodies and spirituality, and just wanting to be in a place of calmness and having that positive energy around you, which you can control, is such a bonus, especially if you're, you know, in the UK, they have different counties that have home birthing teams. So if that is something that you do have, it's well worth exploring and just hearing the different statistics on whether you can do that or not.
Exactly.
Which takes us on to the third trimester. So this is always one that I think everyone in your second trimester, you're like, yeah, it's fine, I'm not nervous. Third trimester hits, you want to start nesting at home, but you're so conscious of the birth, you don't know when it's going to happen. What would you say, again, are the best ways to prepare for birth and to get your head around baby's going to be in your arms in the next month or so?
Yes. And I think first is realistic expectation that you might go over your due date significantly, right? So at least here in Canada, we, you know, kind of have parameters around how long people will be able to be pregnant for, which I think is really limiting. And that's part of how I think sometimes regulation really interferes with the natural process, because we're obligated to follow certain protocols and guidelines and so on. And so I usually tell my mamas that you're probably going to go at least 10 days over. And so put that expectation in now so that you're not at your due date and you're becoming super devastated and super impatient and very grumpy and very uncomfortable. And I actually look at this period of time as like a time to really just go inside and prepare yourself for what you're going to experience, right? Like this might be painful. This might be really, really hard. This might be really, really long. This might be really fast. Like I am surrendering again to this process and trusting that my body is going to do what it needs to do. Because our bodies will. They're smart. Our uteruses are the strongest muscle in our body at this time. You will not be pregnant forever. Your baby can't stay in there forever. So, I mean, we just have to be prepared to be patient. And also, you know, if you're planning home, I really highly recommend you're planning a water birth or at least water immersion for while you're laboring, because We know that it helps with making gravity less, so your baby can kind of move around. We know that babies who are born in water are a lot calmer. They're going from a watery environment to another watery environment. They often don't have that big like cry that you see in movies, and moms are like, oh my gosh, are they okay? And you're like, yeah, they're totally fine. Like, they're just coming into themselves in this new world, right? Um, and so mental preparation, obviously, like read the books, listen to the podcasts that reaffirm positive birth stories, natural, normal birth, because you know it. Anyone and everyone will tell you their horror story. And
Yes.
it just seems to be what society focuses on instead of like the beautiful home births that you see that I witness all the time, where it's honestly just me sitting there and like being like, good job, you're doing great. Like, you're just doing a really good job. Can I feed you some water? Like, you know, it's very special, and it's such an honor to be at and a part of. And we just need to be able to safely hold the space for people without interfering with their birth process. And um, a lot of that, though, has to do with how committed are you to a home birth? How prepared are you for that? And really, like, again, psychological, move through the process. The baby will be in your arms. You know, you can't labor forever, right? Like, your baby will be there and you will have that moment, right? Just trust the process. I don't know how you can prepare, really. Like, everyone does it differently. It looks different for every single person. And again, just to circle back to the beginning where I said, you know, for people who haven't disclosed traumas in their life, really, really important, what I'm finding lately is that people, like, we've had a couple people who will not disclose this trauma, and then they get to a certain point and they just can't push past that point because it's triggering a sensation that is reminding them of a trauma. And if people disclose that to a safe person like me, if you're my client, you know, then I want to talk to you about how that might impact you. And I want to help you move through that so that you can heal, so that you can understand that these new sensations you're going to feel are different purpose, like a different sensation. And I think that's really, really important. And I don't think it's stressed enough in maternity care. It shows itself in so many different ways. So yeah, mental preparation, and then get a birth pool and birth your baby in water and you'll be fine.
Sounds easy.
Yeah. Well, have the right support. Like, you need to feel safe in your space. You need to feel like you trust your care provider, or you trust the women who are supporting you, or whoever your circle is of people who are going to be there when you birth. Like, everyone needs to be on board, including your partner, right? If there's fear in the room and things like this, it's really going to impact the energy of the birth. And so I always consider myself invited to a birth, and I don't ever consider myself like that I need to be there, or that I must be your midwife, because there's not very many of us and you won't find a midwife otherwise. Like, if you go, that's not my intention. It's really to build a relationship, support a mama, and however that looks. If it looks like a hospital birth with an epidural, sure, like, that's fine too. But my niche and my passion is home birth. And so I just feel like it's so special, and it's just something that we get to do as midwives, and not doctors or OBs or anyone else. So it's a process from the very beginning to the very end.
Speaking of end,
Yes.
postpartum, baby's here. So what's good to know about this very special moment of your life?
Yeah, surrender. You don't know your baby. I mean, you know your baby, but you don't know what they're going to be like, right? Like, are they going to be a little bit gassy? Are they going to be fussy? Are they going to, like, whatever, you know, babies have their little things. And, you know, just understanding that the first 3 days are hard. You know, you have colostrum, which is, I always explain it as sucking honey through a straw. It's very rich and nutrient dense, but it's hard to get out, right? And so babies have never breastfed before. If it's your first baby, you've never breastfed before. You've never, hopefully, probably not, had someone on your nipple like every 2 hours, sucking on your nipple vigorously, right? So it's tender, right? It hurts. It's a different sensation. It's perseverance. It's, you know, asking for support, using all the pillows, making sure you have a really good latch. If it's pinchy, it hurts, it's painful, you're probably not doing it right. So delatch, have a good look. Always say tummy to mummy. So baby's tummy to mummy, and nipple to nose. Nose to nipple.
Mm-hmm.
And then you wait for a big open mouth and you just put your baby on. And obviously it's not, I mean, I've done this a million times with moms, helping them latch babies. And this is why having a midwife is so special, because you have your postpartum follow-up on day 1, 3, and 5. We come to your home, we help you, or even a good doula, like, or just a sister who's breastfed before. Like, anyone can offer you support if you're open to it. Your baby's not going to starve, right? You hit day 2 and your baby's like ravenous and wants to be on the breast every 5 minutes. And that's normal because it's a feedback loop, right? The more your baby's on the breast, the more milk you produce. And so often that's the night where moms who don't maybe trust that their body's going to produce the milk will supplement with formula because they think their baby's starving. But there's a purpose behind these things. And I think if we just continually say, oh, I trust this process, oh, there's a reason why this is happening, that's another kind of surrender and preparation, right? And then your milk will come in. I call day 3 or day 4 the Dolly Parton day, where your breasts are just like, and you're like tender and sore. And so all the warm cloths, you know, hot shower, Epsom salt soaks, and then just feeding your baby. There's no need to pump to remove the milk. Just put your baby at the breast. Just feed your baby. And then, of course, like if you have a tear, you're gonna want to just keep your legs close together, let it heal. Collagen obviously supports wound healing in several different ways, but it promotes faster healing. It helps with the integrity and the strength of our tissue for healing. It's also anti-inflammatory. So all of those different components of collagen are going to support healing as well. You know, I'm a big fan of allowing our bodies to tear how they need to tear and allowing them to heal how they need to heal. You know, if it's really severe, I will talk to you about the pros and cons of repairing it with instruments and material and suturing. But I always give the analogy, like if you rip paper versus if you cut paper. And when you rip paper, there's all the little pieces, right, that overlap to help the tissue come back and heal nicely. Whereas if you cut, it's just like, it doesn't have anything to kind of come back together. And so, I mean, I don't know, again, we just need to trust that our bodies are doing and making a space and doing and tearing how they need to, and maybe not tearing at all. Maybe, you know, I'm always like, put all the oil there so it's nice and lubricated, and, you know, coaching people on how to push for the last little bit so that your tissue can actually stretch and expand, instead of just like having that urge to push right through and then tearing terribly. So another rule that I have for most of my clients is 3 days in your bed, 3 days around your bed. And so if you are in your bed for 3 days, everyone's bringing you food, you're literally just feeding your baby and sleeping and eating, and maybe a shower or a bath in there if you want. And then 3 days around your bed, and that just means like on whatever level you've birthed on or whatever level of the house you're living on at that point. And then feel free to sort of explore a bit more around the house. And then by 10 days, like, you should be okay, right? In some cultures, it looks like months, right? Like, we need to give women the time to integrate their experience, to heal, to process, to bond with their baby. I mean, if you're exhausted and stressed out, you're not going to produce milk, you're not going to heal, you're not going to bond, you know? So we need to really nourish the mom and the baby in this period, this 4th trimester. So yeah.
Very nice. And just speaking on breastfeeding, you told me that when we had our conversation last, that it's a natural contraceptive.
Yes.
And I had no idea. So I find like maybe not a lot of people do. So
Yes, I'm going to, yeah. So, it is a natural form of breastfeeding because it suppresses ovulation, of course. And so just because of the hormones of breastfeeding. So if you have no gaps greater than 4 hours during the day or greater than 6 hours at night, your body will likely not ovulate, right? And so this can be about 98% effective up until about 6 months when we introduce solid foods, and the spaces between your breastfeeds might stretch out, and then you might ovulate. And of course, we ovulate before we have a cycle. And so that's how come sometimes people get pregnant. They say, well, I never had a cycle. And it's like, well, because you ovulate before you feed. And so in that little period of time where you think, I don't have a cycle, you might actually conceive again. And so again, it's no gaps greater than 4 hours during the day or 6 hours at night until you start introducing solids. It can be about 98% effective as a natural contraception. So
beautiful.
Sorry, I have got a question, Natasha. Please, can you remind us what herb to help with sleeping?
Yes, it's called skull cap. I'm going to write it down. And the other one is you can purchase it off Amazon, at least here in Canada. I'm not sure where you are, Natasha, but it's called Rescue Remedy. And there are different formulas and different types. So you can get it in, oh, sorry, I spelled that wrong. You can get it in like a gummy form. You can get it in a lozenge form. You can get it in a tincture form or a spray. The nighttime remedy is blue. The daytime remedy is yellow. Of course, I forgot to mention acupuncture. And literally for everything in your life related to pregnancy, especially conception, this is super exciting because my husband is an acupuncturist and he has been treating someone for infertility. And now they have just conceived. And so now they're going to be my clients, which I'm like, wow, that's so amazing. And so we can use acupuncture for so many different things. And I mean, I could go into that and my own experience with my own pregnancies and what obstetrics told me, and then what my husband did in terms of Chinese medicine and acupuncture, and how it has completely altered my view of like medicine in general. But for those ailments, like migraines are a very big one because of our hormonal imbalances. So migraines for acupuncture for migraines, acupuncture for sciatica pain, acupuncture for fertility and conception, acupuncture for induction. There's so many different positive things that acupuncture can do, including for sleep. So coccyx pain, I'm seeing this right now. If you haven't already got a belly band to help bring up some of that pressure of the weight of your uterus on your pelvis, I would highly recommend that. It's just, again, on Amazon, like a Velcro band that you can use to just help bring up some of that weight off of your pelvis and hopefully help your tailbone a little bit. Naturally, we have a hormone called relaxin in our bodies, which make all those joints and the sphincters of your cardiac sphincter in your tummy, which is responsible for the heartburn, and the ligament pain and everything, and your coccyx pain too, are because of this hormone. So thank you, relaxin. But it will, when you have your baby through your vagina, that coccyx actually moves out of the way anyways. And so my biggest recommendation for you, Andrea, would be pelvic floor physiotherapy after you have your baby, just to help make sure that that coccyx comes back to where it needs to, and just to make sure that all those ligaments and muscles are back to where they should be. So it's a tough one, the coccyx pain. I'm sorry.
Congratulations, though, to both of you. That's very exciting. Are they all the questions that we have? Does anyone else have any more questions?
Oh yeah, here we go.
Bethany, how early in pregnancy would you recommend starting acupuncture?
I'd say like as soon as you conceive, you can do I mean, you can do it before you conceive, but I suppose it would depend on what the ailments are that you're experiencing, but there, use acupuncture for literally every ailment. So I'd say it's not a bad time to start build that relationship with your acupuncturist too. Like they're gonna be more familiar with you and your tolerance and your patience and everything. Like they can also help you walk through that journey. Like the more people you gather into your little circle that can support you in your pregnancy, the better.
Amazing. We'll give it
Aw, this has been so fun.
It's been great.
Really appreciate that I've had the opportunity to do this and share some of my passion with you guys. And yeah.
Well, thank you so much, Maddy. I'm sure if anyone has any questions post the call, please do email us and we'll fire them over to Maddy. And as Maddy said, collagen is really key during your pregnancy. So we will circulate a thank you discount to everyone who's joined to get you taking the collagen. I've been taking it and it's working wonders for me so far. Fingers crossed, no stretch marks, although it will be what it will be. And so, yeah, thank you once again, everyone. Really, really pleased with this call.
Yeah.
Perfect. Cool. Well, have a lovely evening or day. Take care.
Thank you, guys. Bye.
Thank you. Bye.